Good morning, everybody. It's such a pleasure to be here with you today. My name is Cimcia Hernandez-Cancio, and my pronouns are she, her, and ella, and very excited to be moderating this conversation about how we can use this incredible work by the organizing committee at the community level. I want to take just one quick moment and especially welcome some folks that I'm seeing that are coming from even outside of the United States to hear this. So very special welcome for all of you. And I also want to give a very special welcome to a few of my fellow Boricuas from Taino lands, although I am here sitting in Piscataway, Manahoic lands right now. So before we start, let me have an opportunity to introduce our incredible panelists. So first of all, I'd like to, their full bios, and you must read them because they're very, very impressive, are on the NAM website. But we have here some incredible representatives of some of the community work that has been done over time. So first of all, I'd like to introduce Takesha Dwan Everett, who is the Executive Director of Health Equity Solutions in Connecticut. Felica Jones, who's the Chief Executive Officer of Healthy African American Communities. Lloyd Michener, who's a Professor Emeritus at Duke School of Medicine. And Nina Wallerstein, who's a Professor at University of New Mexico. So let's start with just some reflections on, and please, each of you just speak up and join the conversation. Reflecting on the expertise and intention behind the development of this model, how do you think that various partnerships or other end users on the ground interested in improving their community engagement efforts or interested in becoming, or communities who are trying to become more engaged in these efforts, use this model? Who would like to start?
I graciously nominate Nina.
Well, okay, this is Nina Wallerstein. Takesha, no, go ahead, Takesha, first.
No. I really do want to hear what you have to say first, if at all possible. We're too gracious on this.
Oh, I'm really delighted to be here. And I'll just say that it's been such a pleasure to be part of the NAM organizing committee and to have such a dynamic and elegant, actually, model produced thanks to the design folks. And what I think it embraces is the core universality of a lot of ways to think. It's not one way to think, it's a lot of ways to think. You know, you can, if you're interested in thriving community outcomes, you can look at those kind of indicators. If you're interested in partnership outcomes, you can look at those indicators. If you're interested in healthcare system outcomes or community-centered outcomes. So I think it's a focused model on principles and outcomes, which I think is really key, you know, the value base we start from, and then the outcomes we care about. I want to kind of defer to talking about what a complementary model is till hearing from others first. But I really do think this is quite an embracing full model. Takesha. Oh,
yeah, I echo those same sentiments. I echo those same sentiments. I feel as though what's interesting from my perspective about this model and what I hope end users will engage with and understand about this model is it's quite comprehensive and quite, I want to say specific is how I look at it. For me, it feels groundbreaking in the sense that it provides a framework and an opportunity to not only assess one's self and how it's doing in relationship to community engagement, but also to provides the markers of where you can go to improve and enhance your community engagement. So to me, it's the both and. Tell me how I'm doing currently, but also gives me the tools to to look at how I can improve, increase, and grow and better and move to better community engagement and improvement of that. And doing so in a way that really leads us to what I personally subscribe to is meaningful communication, meaningful community engagement that's transformative, that centers equity, and that changes systems overall. So to me, that's what I hope end users are able to take away, utilize, and actually gain from this. And as already mentioned, I think it's ever evolving and ever changing. So I see it as a well thought through start, but not a complete finish line, if that makes any sense.
Lloyd, do you want to add anything at this stage?
Sure. I really have also enjoyed the meeting and the discussion. I should add that I'm from Durham, North Carolina, the land of the Eno. But I think what's been really helpful about the model and the way in which I hope it's useful for the academicians and researchers in the group who often go directly to how do we improve health or how do we expand knowledge, that really the center of this, if you look at the model, is about engaging with communities. But beyond that, the principles about how you do that around trust, bidirectional, that it's you co-create, there's common governance, shared governance, multi-knowledge. There are core issues, the principles that one needs to embrace and work on as you engage with communities while you pursue these larger additional goals. You can't do it without engagement. And I hope this serves as a powerful reminder, visual reminder about where you start.
So I think given especially what we have gone through the last couple of years with the pandemic, I wonder if any of you would like to comment on how those experiences have either heightened or understanding about the need for community engagement, and in that context, the utility of a model like this for moving forward.
Well, I'll start in saying I think what we've quickly saw from various aspects of what we're living through the pandemic, both from the outcomes we saw from an equity standpoint, the challenges individuals faced on the community level and trying to access needed healthcare, needed social needs and other items, and moving that all the way through vaccine distribution and access and who's getting it and who's not, is that there is a vast amount of distrust and mistrust that exists between communities, health systems, the government, et cetera. What is enthusiastic for me is that whether you call this propellers or pedals, this model helps to really understand that trust has to be at the core of what you're doing in community engagement, or otherwise you're not doing anything that's more than a transactional opportunity that you can check the box and say you've engaged community. So I see what we've learned from the pandemic is that there's no more urgent time than the ever important now to really begin to understand, one, when we say community, defining that very clearly and explicitly, two, building those trust models. And I think we have a foundation that we've seen in a lot of states and in a lot of health systems who've built trusted messenger opportunities and campaigns to build those bridges and to now really begin to take, if I should be so bold, this conceptual model and determine how do you fully integrate meaningful, transformative community engagement throughout everything that we are intending to do from a health system and health policy perspective.
I think I would add on my personal experiences, having worked with tribal communities for 30 years, watching the leadership emerge and the centering of the actions from within communities has been incredible. Also, partly to deal with the suffering that those communities endured during the pandemic and excess mortality and morbidity, but then the leadership that these communities took in trying to create programs and practices and actually pivoting to food distribution instead of health research, food distribution instead of other kind of superfluous issues, and therefore the trust that had to be rebuilt from healthcare systems and university systems that were saying, no, we have to do this, but the communities knew what they needed to do to protect and their own tribal members. And I think that that was a key lesson for me in being a part and a partner during this time with the communities that I work with, and recognizing that those principles, as you mentioned, Takesha, trust, but also principles I would actually name specifically shared governance and shared power, rather than the power coming from the university or the healthcare system, where how can it be equitable power so that the real needs and priorities of the community are first and foremost. And that's embedded in the model of that sharedness and bidirectionality. And I would also say multiple knowledges. The communities had the knowledge of what needed to come first and during this pandemic. And also, of course, they needed the resources that, within healthcare systems, the vaccines, the distribution, the testing, all of that was key, but that wasn't the only need. And so I think the healing that will come now and the resiliency that they're building from now is even more important, to pay attention to the priorities of their own knowledges that are going to emerge as key for thriving and healing within those communities. And how can we, or me as an outsider, still be an authentic partner and share that accountability to those communities? And I think those principles are pretty embedded within this model. I just called out a few others to think about.
If I could add on to that very briefly, just to build on it, but also to address a weakness, because there's a question that's come up in the chat about that. It's a lovely model, but one of the things we've learned from COVID is the communities differ, and that we tend to think of, or it's easy to think of community as a broad generality, but communities have their histories, their different norms, and you don't have community engagement by picking a couple people and putting them on an advisory panel. What we've been talking about here is we call authentic community engagement, with those principles that Nina's talked about and we put in the model, like shared governance. But you need to know who the community is, and what their history and traditions, what their strengths are, so you can build on them together. So I just underscore, we've given you a general model here, but it applies to specific communities, or it's really powerful when applied to specific communities. And that requires that relationship building community, one community at a time.
Thank you so much for those comments. One question, one thing that is very apparent in the model, and it's also coming up in some of our questions, is the issue of trust, which obviously lack of trust is something that has been an issue within healthcare and other spaces for a long, long time. And the pandemic kind of elevated that there are two issues with not trusting. One is the issue around fake news and fake information, and the politicization of public health, right? Which the system has been really focused on, those people just need to figure out that they're being lied to, and listen to the experts. But there's a very different reality when it comes to the trust issues in communities of color and other structurally marginalized communities, where not trusting is actually rational, not an irrational response. And so given that reality and our recognition that trust needs to be the foundation of community engagement, what do you do with the fact that the trust is not there already? Do you have suggestions or examples of what being trusted requires being trustworthy, right? And so how can we change the way we're doing our work using this model to center and figure out how do we start being more trustworthy? And I think that's really relevant to one of the questions that came up about the fact that there are communities who simply do not feel safe, and the lack of safety is something that obviously is going to affect their ability to engage, and to trust that they can stay safe. So any comments about that? I'd like to start with Nina, because you always have such brilliant things to say about this.
So maybe I will return to what I wanted to also share as a complementary model. Some of this model did emerge from other models that have been in the literature and in the empirical work. And one of them is our Engage for Equity community-based participatory research conceptual model. And that actually tries to answer that question, Cincy, of how you build the strategies to make change. I think what's complementary about the CBPR model that still is available to people is it works with pathways. It starts from this idea that Lloyd mentioned, that context matters. The local context is different in tribal communities and African American communities, in Puerto Rican communities, and even in different localities of the, I can't work in one tribe in New Mexico and think that it's exactly the same as working in another tribe in New Mexico. All of those local contexts differ, the histories differ. How do you even begin to understand those histories? Our CBPR model says that the histories then impact the strategies, the partnering processes. And we divide those in empirically. We've actually surveyed over 400 partnerships around the country. We know that there are structural ways to build trust, and we know that there are relational ways to build trust. You can be a good person, but if you don't have formal agreements that codify shared governance, if you don't have shared participatory decision-making that's codified as this is the way we do it in a structural way, trust can be broken very fast. So we've built pathways from context, understanding the context, knowing then that impacts the partnering processes, both structurally and relationally. And that then impacts all of the actions that you take. The domain of your research or your programs or your practices is based on how you build your structural practices and your relational practices. And then that builds the equity outcomes. So the CBPR conceptual model is 4 domains, not 4 outcome domains, but starting with context, going to partnership processes, then to actions and research and intervention or practice actions, which then lead to a whole variety of specific outcomes related to education, economics, health, housing, or also related to equity and also related to social justice. So these are 2 complementary models, and this important idea that just because you say you are going to do trustworthy things does not mean you're doing trustworthy things. So I urge you to look at pathways, and I think any model needs to start looking at what are the pathways and strategies for good engagement to get from values to outcomes. And I think that's what's complementary about the CBPR model is we have empirical data about what are key good pathways to make change. So I think that that's kind of 2 models that can be thought of together as helping move us in this direction. And I think with the new model, the new NAM model, we do have to look at pathways. We haven't done that yet with the new model. And so I think that important way of just focusing on trust for a minute, there are structural, formal ways to kind of move together so that you can build trust. And over time, trust is not you get it and then you're done. Trust is a daily action. And so you have to prove that daily action, both structurally and also how you relate to people relationally. And so I think that I'm hoping I didn't overwhelm this answer here, but I do think there's 2 things I was trying to say. One is that the pathways in any model are something to really be thinking about. Strategies are important, not any community engagement. Any action, it doesn't build trust, but really what are the best and promising practices that build trust or build shared governance or build the way to those outcomes that we all care about. So thank you.
Takesha, I'd like to ask you, because I know that you have been at state level doing a lot of organizing with communities on health equity issues. What does it take to function and act in a trustworthy way?
Yes, So I'm going to start with a kind of plain sentence and then I'll explain it. I don't know if it's plain, but it's the sentence that I have. Acknowledgement without internalization and action to change means nothing. So let me explain what I mean by that. To be trustworthy and to gain trust, you first have to acknowledge that trust was broken and or was never there. But a mere acknowledgement of it without internalizing what that means and actually building into it the reality of what change looks like is worthless. So when we're talking about building trust, oftentimes there is a challenge that no one has acknowledged that trust isn't there. It's we have to build trust, and no one wants to acknowledge that you weren't trustworthy at the point of engagement. So when we start asking questions like, I don't understand why the community just didn't show up when we asked them to come. I don't understand why we can't get the outcomes that we're looking for when we've engaged the community. We've asked them what they wanted. We've done what they wanted. The trust, the line and the bridge to trust was not there. It was broken already. It didn't exist. And you have acknowledged that. Once you've moved to acknowledging it, you have to internalize what that means. And you have to assess and understand what is going on. What do we need to do differently? And it's not a question you can ask on your own. We can't ask ourselves, what do we need to do to change to be trustworthy if we're not getting the input to understand why the trust was broken? So to me, it goes back to this model, the bidirectional learning, the bidirectional conversations, the understanding of the historical and contemporary reasons why people do not trust is really important. And it comes to that action, as Nina was saying, building different structures, building anew, putting in the direct pathways, the consistent assessment of that trust, the consistent acknowledging when you have misstepped. For me and in my work, that's what has made the difference. It's not coming in saying, I know better, I am better, we are better, be better. Those aren't the statements. It's the 100% acknowledgement. There's something broken here. Tell me what it is. Let's discuss how we fix it. And then let me hold accountability for myself internally, as well as you hold accountability external for me building that trust consistently. And let's continue to evaluate and understand this over and over and over again. That's the only way we're going to be able to build trust and to maintain that trust and to maintain authenticity.
And thank you, Takesha, for that. And I think there's even a finer point in that a lot of the way that the academics and policymakers and decision makers have approached these issues are like that something got broken. And let's be real, it's not broken. It was designed that way, right? And not acknowledging that, there was never trust, that, the government and corporate actors never were not even thinking about trust and acted in extremely untrustworthy ways because they designed systems that were intentionally made to not work for these communities, right? And for our communities. So that's, I think, another aspect of you're not rebuilding something, right? You're trying to change something that was never intended to work for you and for your community. And if we pretend that it was, then we're not going to get anywhere. So I wanted to follow up and see, Lloyd, if there was something that you wanted to add.
Yeah, there is. And it's been a wonderful discussion, but I want to draw a sharp line or underscore a point about there's being trustworthy as a person, as an individual, and there's being organizational trustworthiness. And we often tend to think that I'm trustworthy and therefore there shouldn't be a problem, forgetting that we're part of organizations that, as Cincy well said, have other agendas and have histories that may make building trust or earning that trust quite complicated and challenging. The other point, and I'd add just briefly, is I made the comment that community, you have to build trust. It's a relationship issue, and it's one community at a time, but communities have commonalities, and you actually can work collaboratively. And many folks on the call have histories of doing that. My point is just to not assume the communities are alike until they discover that, or until they decide they are, or find the similarities, allow them to find common solutions. But again, to Cincy's point, what the model helps us do is build those bridges and commonality so the communities, plural, are at the center of the work, and we're supporting that work and building on their strengths. But it's us as individuals and as part of our own organizations doing that.
Thank you, Lloyd. And we're getting a lot of questions, related questions also around power, right? That at the end of the day, what we're seeing, this is all the result of, I wanna point out my a wonderful thinker out of right now Morehouse, Daniel Dawes, who wrote about the political determinants of health. Because I think one of the things to really think about is that sometimes we're thinking about these contextual issues as if they were like, I don't know, the weather, and not the result of decision makers making decisions and choices where some groups and some communities are consistently not allocated the power, the health assets, that in equitable ways, and are also then piled on a lot of risks to their health. And that is not a coincidence. That is not something that happens like the weather. It's something that is a result of actual decisions, right? And so that boils down to power. And we're getting some questions around, what is the difference between, engaging with the community versus actually sharing power? What does that look like? I like to think about this as like kind of the vanilla ice principle. Bear with me. You got to stop, listen, and collaborate, right? And instead of stop, collaborate, and listen. But I think the question here is what does collaboration really look like, and how can it be more than just really relying on the goodwill of some great people? What happens when those people are gone? Or what happens when that person, bumps against their limits of power and ability to make decisions in a system? So any thoughts? I'm sure there are a lot of thoughts about that. Who would like to start?
Well, I think I'll try. Maria Rohrer just wrote this beautiful piece from looking at micro, meso, and macro levels of power. And I think, partnerships are kind of in the micro and meso world, but the history of macro power issues of genocide and attempts to assimilate and forcing people off their land, and those are macro issues, at nation and global states. And of course, different nations have different authoritarian domains of power or democratic domains of power. So we're in multiple contexts again. And so how do we as partners or individuals, as Lloyd was talking about, try and break into those institutional and structural histories of power? I think is a really huge, huge question. I think it's probably bigger than what's even in the model. And I think we need to acknowledge that the model doesn't quite go there at that macro level in those histories of, that have to be challenged. But I do think it's the central part of engagement. Power and equity are in the model, which is beautiful, but really understanding where they come from, those histories, is not. And so I think we need to kind of think about always bringing that to the fore. And what can we do? I'm in the middle right now of looking at institutional barriers and what are those institutions at different institutions, Morehouse being one of them, and just interviewed Daniel Dawes, and he's a wonderful, wonderful thinker and wonderful proponent of the political dimensions of health and of power. And I think that that kind of looking at the different institutional changes that we need to promote, not just out in communities, but in our own institutions. I guess I would add that bidirectionality to make us be aware, that's in the model, the bidirectionality, that we need to transform not just communities, but we need to transform our own institutions that we work in that are part of the system that make it difficult to do authentic engagement. And I think it's really important for us to be looking at policies, practices, norms, climate, all, the dominance of, white academics versus academics of color. I mean, I think there's a whole change that has to, historically, we have to still demand those changes. So I would just thank you for that question.
Lloyd?
Yeah, if I could, as usual, build on Nina's comments, I'd underscore that things are changing. We have a long way to go, but there's a lot more interest in this topic than there was 2 years ago. I mean, for those of us who've been in this field for a long time, there's a sea change. And I think this is a time for folks to take the model and to help our institutions along on the journey. So we have everything from academic health centers who are saying, okay, what do I need to do and how do I do it? Which is a change because they used to be, they didn't care as much. And you have the AAMC with its Center for Health Justice. We're coming out with guidelines and recommendations. You got the states, the California Reducing Disparities program, and you have groups within the organizations. This is a time to network, connect, and not assume that the groups who didn't know how to do this or did it really poorly before are still incapable. That may be true, but it's a good time to connect and start being part of larger coalitions, really to help our communities be healthy and to change our institutions so that they support that.
Thank you. And we're running out of time, but I want to give Takesha an opportunity to answer the question.
So I first want to acknowledge my headphones died just as this powerful question came up. So forgive any background noise, and I'll try to be brief in saying, for far too long, and the United States generally and in our world, we've confused power and authority and have mistakenly thought that because people had the legal structural framework of authority, that dictated who did and did not have power. And far too often, individuals, both in community and communities of color, as well as in authority, have really thought that power rested in your legal framework of who had authority, in the social framework of who we thought was powerful, rather than understanding that people have always been powerful. Even when subordinated and oppressed, there was always power that rested in the hands of the people. And that's why there were structural decisions to discriminate and to try to strip people of that power. So in answer to your question, for me, connecting this to this conceptual model, dissecting that difference between power and authority is really critical. And remembering that change and what we need to do for communities is always rested in the power of the people who lived in the community, not the people we have elected and given authority to.
Thank you so much, Takesha. What a way to end this section. I hope folks were taking note. And at this point, I want to thank the panelists again. Always wonderful conversations when you guys are involved. And I want to now hand this over to the moderator of the next session, which is our organizing committee members addressing audience reactions and questions. And for that, I'd like to introduce Bobby Milstein of Rethink Health. And again, thank you all so much for this opportunity and to the panelists for being part of this conversation.